Welcome back. As always, it is your friend Arachnid Soul coming to you today with something a little bit different, a little bit political, but very honest. And I'm going to get into that in a second. In the meantime, please do me a favor and smash that thumbs up. There's a very intentionally dishonest slant to corporate media in the United States. It's always slanted towards the big banks and the oligarchs because those are the people who own the TV networks. And that way, the American people also talk about things from the viewpoint of the very rich, of the 1%, which is why you will hear people talking about different social programs that would help them, their children, their aging parents, their next door neighbor, and they'll follow that up by saying, but we can't afford that. So right now I thought we're going to watch this clip. This is now President Joe Biden. This was taken in March of 2020 before he was president when we had President Trump. And we're just going to have an honest discussion about this, and we're going to break down Joe Biden, and I'm going to translate Joe Biden for you. I'm going to tell you what he's actually saying, what he actually means, why he's saying it, so you can get behind this actor that is Joe Biden. And keep in mind, I'll be watching this for the first time with you, but it's the same through line of bullshit with all the American politicians in the one political party the United States has, the half Democrat, half Republican party, owned, bought, paid for, and sold by the same banks, oligarchs, and large multinational corporations. We will talk about all of that on another day. In the meantime, let's watch this clip.
As you've been seeing, our healthcare system seems to be crumbling underneath this crisis. There is not enough. There's not enough support for the healthcare system. There's not enough support for the American people inside of the healthcare system. Are you now reconsidering your position when it comes to single-payer healthcare?
So let's break this down for you. Single-payer healthcare is a system that most of the countries in the world that call themselves first world countries have. Single payer basically means that as the people pay taxes, which they're already paying, the government says, we're going to take some of the tax money you're already giving us, and we're going to give you health care as a right. In the United States, this would take a program called Medicare, which you have to be older to opt into, and it would simply expand this system of way more affordable health care to everyone. The system the United States has now is not just a health care system, it's a health insurance system where there is a middleman called the health insurance company, which needs to be paid. So between the patient and the care from medical professionals, we invite this group in, and this group, by the way, has the objective of taking in people's monthly payments for insurance and then denying them coverage as much as they possibly can. Let's see how Joe Biden responds to this one.
Single payer will not solve that at all. The thing that is needed is, for example, we have a whole number of hospitals that are being so stretched, including rural hospitals, they're going to need more financing. That doesn't come from a single payer system. That comes from the federal government stepping up and dealing with the concerns that they have, the reimbursement that they're going to get, how they're going to be able to move forward, and how they're going to be able to provide all the needed help that are needed in their communities. This is an opportunity to look at reconstructing the healthcare system in a way that, in fact, can respond more rapidly and more effectively to these kinds of crises, because it's going to come again. We should be spending, and we are spending, a great deal of time and effort finding a vaccine, finding a way that we can deal with preventing these diseases further down the road. But for example, we had people, when our administration, we had CDC people in other countries.
One of the main goals of the Democratic establishment in the 2020 campaign, people act like they don't want to know this. This has been reported. This is known. People inside the Democratic establishment have admitted this. There were two main goals. One of the main goals was to kill Bernie Sanders politically, and in doing so, kill the whole progressive movement, the movement for the people, by the people, funded by the people. And the other thing was to get mostly Democratic voters to stop talking about single-payer health care, to stop talking about Medicare for all. Both of these things were accomplished. Now, what they certainly do not want to do is go back to talking about health insurance. I think they figure Medicare for all or single payer is going to pass at some point, but they're paid by Big Pharma to try to hold this off as long as possible. So Joe Biden starts out with the company line, the Republican and Democratic company line, and now pivots away to COVID. And the reason he's also doing that, and we won't get into this, is because this is March. He's running against Trump, and he wants to highlight Trump's inadequacies in handling COVID, which he understands he can exploit to then become president. And even if he weren't running for president, those would still be true criticisms, but he's sidestepping the question asked to go into talking points. Let's continue.
Because we wanted to anticipate when, in fact, another virus would occur, when, in fact, a pandemic might occur as a consequence of a spreading virus in another country, to act quickly. President, we withdrew those people. I insisted that I didn't insist.
I'm going to stop here. I just want to tell you, and you can look this up, in February or March of 2020, before the American population was really, really made aware, there were stories, you could read things, people on the internet knew from December of 2019, if not earlier, about COVID. But the business leaders in the United States got together, politicians got together with them, and they discussed the future of the economy and figured out where they should invest money to make the most money through COVID, and also where they should take out money. And another thing you have to understand is both the Republicans and the Democrats had and still have, these are just the establishment people, the objective of trying not to give people stimulus money to keep them whole. The whole objective was, don't give these people any money, give them as little as possible, and let's wait as long as we possibly can to give them that little amount of money, and after that, let's try to do it as few times as possible. Which is why Joe Biden, Trump, nobody really talked about this until a little bit later on. Let's get back to Joseph Biden.
I suggested that we should have people in China at the outset of this event. And when it all started in Wuhan province, and what happened? We did not insist that they go into the areas we wanted to. So I just, that's all I can do, is do what I know has to be done, say what I know has to be done.
Let me point out that there is serious thought now, and we're going to find out, hopefully, if it's true or not, that COVID actually leaked out of a lab in China, and this was a lab that Chinese money as well as United States money was funding. So by this point, again, this is March of 2020, and just to give you a brief bit of history, also not reported in the media, but if you don't believe me, please check this out. Bernie Sanders was running in the Democratic primary. He won the state of Nevada with 70% of the Democratic vote. People then started calling him a socialist and a communist. When that did not work, President Obama, who had said previously he would not get involved in that election unless it looked like Bernie Sanders was doing well, then he would get involved to stop Bernie, which he did. And the game plan was, if you're not aware how the Democrats actually did it, many Democrats who were running against Biden, people like Amy Klobuchar and Pete Buttigieg, received a call from President Obama at some point, and Obama told these people, listen, even though some of you are ahead of Joe Biden in the polling, even though we didn't want Joe Biden to be president, we wanted Kamala Harris, but since Tulsi kneecapped her in a debate, we're going with Joe. We want all of you to drop out, and we want all of you to give your support to Joe Biden. Why? Because we realize it's highly unlikely that any one of you is going to have the votes against Bernie Sanders by the time we get to the convention to cinch the nomination. But if you all pull out and all of your votes get behind Joe Biden, Bernie de facto will be eliminated. And also we'll make sure that you each get either jobs in the Biden administration or very nice paying jobs, long-term jobs elsewhere. And that's how Joe Biden got the nomination. Side story. Let's see how this continues.
So if you become the nominee and then you do win the general election, a lot of ifs there, how quickly in that matter can you reassemble the pandemic team that the president got rid of?
Very quickly. Very quickly. It could be done very quickly. And that's what my team is talking about right now. How will we do that if we win? And what will we do exactly on day one? How will it start?
Joe Biden basically continued the exact same policies overall, and also regarding COVID that Trump did. And actually, in some ways, and it's hard to believe, but Joe Biden actually has handled COVID in certain ways worse than Trump. Let me give you some examples. When the science was horrible on COVID, when we were looking at deaths, the suggestion was we should shut down the schools. Students should not be in the schools. Trump wanted people in the schools, but the schools were shut down anyway. Biden came back into office. Things are just as bad. As a matter of fact, months after Biden came into office, COVID was up. Was it up because of Joe Biden? No, not at all. It was going to be up no matter who was president at that time. But Joe Biden actually incentivized the schools to open back up against many of the teachers' unions, against the scientists. So that's one way that Joe Biden was actually worse than Trump on COVID. The other being that Donald Trump wanted to give the American people stimulus checks of $2,000. Joe Biden wanted to give people stimulus checks of, I believe, $600, and then said, okay, if I'm elected, I'll give you checks. You'll get $2,000. And at some point, people already had the first $600. When Biden was elected, instead of giving people $2,000, he gave people $1,400 and said, oh, that makes up the difference, even though not everyone even got the $600. And that was really playing with the hearts, the minds, the logic, the emotions, the bank accounts of the people. There's your president, Joe Biden, asked about the American healthcare system, pivoting away from it to talk about Donald Trump, much the same way that he will continue to do even though Trump lost the election. In any case, we're going to come back. We're going to translate some more Joe Biden for you, and maybe I can't sit through Trump, but we'll find some Republicans. And it's not that Trump's politics are any worse than Joe Biden's or any of the other establishment people. It's just, I at least need to see an actor, a character who takes his role seriously. I understand these are talking points given to you by the super rich, but for the 6 minutes that you're on, at least pretend that you've memorized the material and done some independent study. In any case, it has been your friend, Arachnid Soul. We're going to come back. Please comment down below. Please smash that thumbs up. Please don't fight down below, because again, I don't care if you're a Democrat and the next guy's a Republican or vice versa. We're all getting screwed by the same Republican and Democratic establishment that is one political party, not two, working together to make sure we keep fighting each other, and at no point do we rise up and realize what the people at the top are actually doing. And I will catch you, my friend, later.